Hello, everyone. Welcome to the 54th Bi-Monthly Breastfeeding Coalition's webinar. I am Danae Hartfield, the Coalition's Relations Coordinator at USBC, and I'm so glad to have you join us here today. This series is jointly hosted by CDC's Division of Nutrition, Physical Activity, and Obesity, and by the USBC. The webinars referred to as the 222 are held on the second Tuesdays of even-numbered months from 2 to 3 p.m. Eastern Time. The purpose of this series is to bring together breastfeeding coalitions to share best practices and news and to network and collaborate on issues of national significance. We alternate the sessions to bring you highlights from national level and state and local coalition initiatives. In June, Galen Sherwin from ACLU shared information about the legal protections for women related to pumping at work so we can all support them in exercising their rights. Coalition members and breastfeeding advocates from around the country can join us for these free webinars. Please join the Coalition's Learning Connection to get all of our announcements. Topic and speaker details are posted 1 to 2 weeks before each session on a page on the USBC public website. As of April 1st, to streamline access, these webinars have now been set up as a series, so you only need to register for the series once. You'll then receive auto reminders of each session with the topic and speaker details. The webinar presentation, handouts, and video recordings of this and past sessions can be found on the Coalition's webinar page. You'll have that info on your webinar confirmation email. And we do want to remind everyone that due to the extension time of today's webinar, regional calls have been canceled. For today's session, all participants are in listen-only mode. We do set aside 10 minutes for questions and answers at the end of the presentation. You can type your questions at any time during the webinar. And here's how you do it. Go to the control panel on the right of your screen. If you don't see it, it may be minimized. Click on the orange tab and it will pop back out. If you scroll down below the audio section, you'll see a tab for questions. When you click on it, it will open up a box for you to type in. If you have any webinar-related tech problems, please send an email to coalitions@usbreastfeeding.org and our staff will do their best to help you. And that brings me to today's session. Coalitions, building a grassroots to treetops movement, needs assessment findings, and capacity building supports. The focus of the Surgeon General's call to action to support breastfeeding on developing and strengthening state coalitions recognizes that it is at the state and local levels that initiatives will be implemented and adapted most effectively to address specific populations. Strong, well-functioning coalitions serve as powerful vehicles for mobilizing action on policy, systems, and environmental approaches to building a landscape of breastfeeding support. Today, we are especially excited to have USBC's very own Kinkini Banerjee, Senior Coalitions Relations Manager, present to you. And with that, I will turn it over to Kinkini.
Thanks, Danae. Good afternoon and good morning to you, depending on where you're joining us from. It's such a treat for me to be on the other side of the mic today because I get to talk about what's the best part of my work at USBC, which is partnering with you and learning and being inspired by you and sharing our journey together as accomplices as we work to make every woman and family's breastfeeding goal a success. So for today's session, we'll discuss the needs assessment process and some of the data highlights. We were so glad to get almost every state and territory participating in this important assessment. We will also be, I'm very excited to share with you the self-evaluation tool called the Markers of Effective Coalitions, and then also discuss plans, USBC plans for capacity building support for coalitions. Many state and local coalitions have been in operation for years. However, a number of states did not have a coalition. Surgeon General Regina Benjamin's call to action to support breastfeeding, which was released in 2011, galvanized the momentum for coalition building. The call to action rallied everyone to help make it easier and focus strategies in 6 key areas. The call to action identified, recognized USBC and state coalitions as key partners in the public health infrastructure. Just as the call to action was a recipe for change, the ingredients were in the socio-ecological model. And as you see this model, you'll see the mom and baby dyad at the hub, and then you see the different layers of the whole spectrum of players and stakeholders who need to work together to change the landscape of breastfeeding promotion, protection, and support in the U.S. So what does this mean for us as coalitions? Clearly, we need everyone engaged. We need all of these ingredients to be aligned within the recipe. And this shows that right from the grassroots, look at the pink region and you can see the families, friends, other mothers, co-workers, to state, local health governments, and every other entity in between that comes in contact with young families and babies. So we need all of these to build a breastfeeding movement that has maximum impact. So we know that strong, well-functioning breastfeeding coalitions are powerful vehicles and have the ability to galvanize grassroots to treetop movements for change. And one reason why coalitions are so much more effective is that they have much more reach and can accomplish objectives beyond the scope of a single organization. They have a greater credibility than individual organizations. They help members understand their jobs in a broader perspective, deepening the understanding of the issues and commitment to shared goals. The coalitions have the capacity to engage members to advocate for solutions that simultaneously impact multiple problems, and often they create new mechanisms or pathways for communities to work together to address complex, interconnected issues that cut across different disciplines and sectors. And the best thing about coalitions, one of the best things, is they also conserve resources by eliminating duplication and streamlining efforts, and also expand the field by encouraging new participants, dialogue, and explorations. So this assessment was a systematic exploration of the way things are with the coalitions currently and the way they should be and could be depending on the coalition's own aspirations and goals. So we wanted to see what the current situation was, identify your priorities and challenges, and explore possible solutions and growth opportunities. So, and also through this process, get a landscape of all the breastfeeding activities and initiatives that are happening across the country. And most importantly, this process was one in which we wanted to engage in a deeper way with state coalitions, strengthen online surveys, one survey to be completed by coalition leaders. This was a pretty extensive survey, and we specified that it had to be, it was best completed by a group of people in a collaborative process rather than a single leader completing it. We also had 2 or 3 surveys completed by coalition members who represented different sectors, could be mom, public health person, community member of the coalition. And after the online surveys were completed by the state coalitions, we scheduled about 90-minute interview sessions with a panel from a group with every coalition, and the group consisted of leaders as well as member reps from each state coalition. And this was really a good way for us to follow up on some of the questions and priorities, ask much more about the linkages and partnerships. We got some great qualitative data from the phone interview process. This gave us a really good idea about how primed some of the coalitions were to be ready to take on funded projects as well. So without any further ado, I'm going to share with you some of the highlights. One of the first things we hear as USBC and as a member of a coalition myself, is do we have funding, where does the funding come from, and what is our fiscal structure? So we found that about 32 of the coalitions had some form of a nonprofit, either a nonprofit status or a tax ID. And then about 8 of them were house nested within another organization and contracted with them through a fiscal sponsor. We wanted to know how many coalitions across the nation had dedicated paid staff. And at the time in 2014, when we did it, there were 6 coalitions, state coalitions, that had paid staff. At this time, it is 4. So 2 of our state coalition staff have lost their funding since the time that this survey was done. To find out what were some of the different sources that the coalition got its revenue from, we found that about 31 coalitions of the 50 had some form of member dues, and most of them were pretty modest, $10 for individual memberships for the whole year. So it wasn't a big source of revenue, but it was definitely something that most of the state coalitions were either doing or were exploring different membership opportunities, whether they should have something for organizational members and something for individual members. Coalitions, we found that almost half the coalitions use that the professional network to do professional development. So seminars, conferences, summits, annual events were a big part of coalition activity and programs as well. At the time that we did this, about 13, 14 coalitions had some kind of state-funded projects. Some of them had foundation-funded projects, and others were through other funding sources, could have been through charities or through other networks. But since that time, again, there have been many new opportunities in the field, and our coalitions are doing more state government-funded projects currently. We wanted to find out how many states had a non-WIC state breastfeeding coordinator in the Department of Health, Department of Public Health, and whether it was a full-time position or a half-time position. And at that time, we had 4 that actually said yes. They have 4 full-time states with 4 full-time FTEs as state health breastfeeding coordinators. About 25 states said no, and then we had about 21 states that did not answer. They said they did not know what it was. And then when we followed up with the phone calls, we found that there were many health departments that had a perinatal director or someone from the MCH who did some breastfeeding work, but it could be like 0.2% of their time, less than quarter time for most of them, and that they did so. If we averaged it out, it would still be about 5 FTEs for the country right now of non-WIC breastfeeding coordinators at the state level. We were very eager to hear about work plans and any kind of strategic plans that coalitions had. And at the time that we did this, the data collection, which was through 2013 and 2014, we had 22 coalitions that said that yes, they did have a strategic plan, and 26 coalitions said they did not. And again, our phone interviews were a wealth of good information where folks were able to get into more detail and talk about the fact that they might not have had their strategic plans right now, but some of them were embarking on a process. Some had strategic plans coming to an end in 2015 and said they would be doing their next planning process in 2015. So we expect that at this time, we have about 35 coalitions with strategic plans or some kind of formal work plan. So given USBC's focus on diversity and equity in the field of breastfeeding as well as in our membership and leadership, we wanted to assess what the demographics of the state coalition leadership look like. And you can see from this, the x-axis has the number of leaders and the y-axis has the number of coalitions. And the first one that you see against 0 with the tall bars shows that about 45 to 48 of the 50 coalitions did not have leaders, chairs, vice chair, secretary, treasurer, or any of leaders who were Hispanic or Asian or Black or American Indians. So you can see a lot of folks. There were some 1 or 2 that had one leader who was of color, but this really, and the coalition's leaders themselves acknowledged the fact that there was very little diversity, and we were glad to see that there was a very big interest from coalition leaders to want to actually engage and see how they could do more outreach, recruiting within their partners and networks so that they could get a more diverse leadership, and that included not just racial diversity, but in terms of age, education, different sectors as well, getting more folks from the community. We also wanted to see what kind of diversity was there among some of the other leadership roles within the coalition, work groups, task force chairs, and this kind of reflected also, though this was a little bit better than the coalition leadership, we still saw that most of the state coalition committees, task forces, and work groups were still did not have people of color in their leadership roles. This was a way to look at some of the governance. This is an indicator of coalition effectiveness again. If there are policies in place, if there are job descriptions for your chairs, for your leaders, for your members, if you have bylaws. And this one again shows the number of coalitions across one axis, and then along the x-axis you see the different. And so it's good to see that almost 43 coalitions had some kind of formal vision, mission statement. Many of them had bylaws as well. Fewer, about 10 had formal policies and procedures. Many more had bylaws. And then you could see as you go down the line, you'll see that the roles and responsibilities for the leadership, you saw a few more coalitions that had, maybe 12 to 14 coalitions had roles and clear defined roles for the leaders, but very few had any kind of roles for the larger membership. It's a volunteer-based organization, so it's totally understandable. And then you saw that if you go down to the right, you'll see that orientation for new members, conflict resolution processes, any kind of community norms or rules of engagement were some of the areas in which the coalitions did not seem to have much documentation and governance. and most of the coalitions really expressed a great need for this. We wanted to see what kind of membership representation was there in the coalition, and you can see that many, more than 40, had parents or consumers on their membership roster. Healthcare providers, from physicians, nurses, nurse practitioners were a large part of coalition leadership and membership. Dietitians, professional and peer lactation folks, WIC as well as non-WIC, peer support staff were part of the coalition. And also we saw many coalitions, more than 40, having childbirth support, midwives, doulas as part of their leadership and membership. Students formed a big part of coalitions. There were some, especially those that were close to universities that did breastfeeding research, where the faculty members were a big part of the coalition as well, but not too many coalitions had faculty, but students were a big part of coalitions. Looking at sectoral diversity, again, this is in terms of membership in your coalition. Who are the ones who regularly attend meetings? Who are the ones who are engaged in the coalition task forces and committees? We did see that about half the coalitions that responded said that they have someone from the state WIC program, or about 8 said that they had state MCH folks in their coalition, local health departments, state health departments. Again, you can go down and see some of these. Looking from at this chart, the ones that are the lowest represented in the coalition membership were child care providers, community health clinics, third-party payers, any kind of insurance companies or payers. And continuing on our sectoral diversity, again, you see a very low representation of community-based organizations within the coalition membership. Very few civic organizations or faith-based organizations or community-based groups that primarily represented communities of color. You did see coalitions, breastfeeding coalitions, having natural partners with other obesity, chronic disease prevention coalitions, or MCH, Healthy Mothers, Healthy Baby coalitions at the state level. The mother-to-mother support groups were mostly La Leche League leaders who were active members of state coalitions. And then we had local WIC clinics, often WIC staff. If they were closer to a state coalition, they were involved. Again, about 10 of the coalition said that they, on a regular basis, they had WIC staff attending or engaged in their coalition activities. Most coalitions had individual and organizational members, and then almost all, 47 of them, had an email list of supporters who may not attend meetings, but they were on the news to get progress updates and to do some, to help with events and other activities. So this was interesting. When we asked local state coalitions, do you have local or community coalitions in the state? 41 coalitions said yes, they did have local coalitions in the state, and then 8 said that they did not. But if you go back and see, you'll see that only 10 of these local coalitions were part of the membership. So they, although these local breastfeeding coalitions, see the last line on this graph, it says 14 of them were part of the membership. Only 14 coalitions said that they were, although 41 said that yes, they did exist. So we did see the need for, and coalitions expressed the need with for greater collaboration and coordination with their local coalitions. So a big part of coalition effectiveness is not just their work plans or whether they have bylaws and things, it's the coalition culture when you use a volunteer group of experts to come in and give their time and talents. It's really important to be able to manage the group. And as someone very succinctly put it, coalition management is not for the faint-hearted. So we did look at some of the indicators here were whether members have meaningful input in the decision-making process, whether there are opportunities for members to take on leadership roles. And for most, the leaders did have a pipeline for members to become to assume some leadership role. We also found that most coalitions had a pretty collegial and high trust working relationship. Tough battles were definitely present among some coalitions and there were conflicts, but 30 to 35 of the coalitions said that the working conditions were really good. Now, it was interesting. Leaders and members both felt that the coalition was a very good hub for networking amongst themselves. So 20-25% said that to a large extent the coalition provided them a networking hub. 25 said that it was to a moderate extent. As you go down to the right, you will see that when it came to media relations or efforts to promote the accomplishments or awareness of coalition in the outside world, that coalitions felt that they had very little to no extent of progress on that. And also when it came to acknowledgement of their accomplishments among the larger community. About 10 to 30, 35 of the coalitions were engaged in some kind of legislative or administrative advocacy work, and some were just at the starting phases, and some have been veterans and pros and have been working on different aspects of nursing in public, and were also moving on to other allied ancillary issues such as paid leave, and supporting working women at work, lactation accommodation in the workplace. We wanted to see what the social communication scene was with the state coalitions and if there were any new technologies that they wanted to learn. And you can see that almost 40 coalitions, 41 at that time had websites. Now we have more coalitions with websites. Many had Facebook pages. Some, about 10, had Twitter handles. And when we asked, do you want to plan or do you want to learn to use how or not interested at this time, you can see that the not interested at this time were mainly for things like blogs and Twitter. Many use some kind of online survey tool, and many wanted to, about 16 coalitions said that they did not use e-newsletters, but really wanted to learn how to create their own newsletters, and so that they could recruit and engage the larger membership more. So this question was about community engagement. and we wanted to see how if coalitions had conducted a needs assessment either within the community or among its members, and you can see here that 31 coalitions said no, they had never done a needs assessment, and 18 coalitions said that yes, they had. But of the 18 that had done a needs assessment, more had assessed their membership about their interests and things, and fewer, I think only 4 coalitions had done some kind of comprehensive community assessment where they really looked at what the priorities and needs of their own, either at the local or state level population was. These were some metrics to measure impact, and it was just how much did they engage with some of the call to action, the Surgeon General's different action groups. So you can see that the red is for very active, green is for moderately active, blue is for minimally active, and yellow is not active at all. And most coalitions did not do a lot of promotion campaigns or did not reach family other than the mothers. So when you see Action 2 with fathers and grandmothers, more than 30 coalitions said that they had absolutely no engagement with that. As you can see from here that the red lines, which are the longest with the coalitions, are on continuity of care, on standards of care, on supporting mothers. So these were the ones that were the actions that the coalitions were most engaged in. We did see lesser engagement between the state coalitions and national membership, but we heard loud and strong voices from the coalitions to say that they really wanted to have more connections with the national USBC national members like Moms Rising, APHA, AAP, and see if they could work with some of the state chapters for them and have them be part of their coalitions as well. Paid leave is growing right now. Donor milk is also one of those that are growing. Access issues are growing. So these are all, again, data from 2014, and you can see that 2015, if we were to ask the coalitions now, we would have more showing in paid leave, on donor milk, and access to peer and professional care, as well as child care. So here are some of the highlights. We found that most state coalitions were working on at least 2 things, and that was maternity care practices and workplace support. Almost all coalitions that we spoke to said that they were working on hospital-based maternity care practices. Many were also working on, increasing number of coalitions were working on childcare and infant feeding practices out there. In 2013, 2014, a lot of coalitions were also getting ready to embark on projects to do with peer and professional support. And with the ACA and the different provisions for lactation supplies and support, many coalition leaders and members said that they were working with their networks to really gain clarity to themselves, to their own membership, but also to the stakeholders on the insurance coverage issues. And increasing number of coalitions said that they were working on milk banks and donor milk issues. So what was so inspiring about the coalitions were that, considering that almost all coalitions were completely volunteer-based, where people had, full-time day jobs, and then they did this as their second job, it was just great to see how passionate and committed these advocates were and how much time they gave to coalitions. And we did, like I said, most coalitions do have some kind of a formal planning structure. And then almost all coalitions do some breastfeeding awareness activities within for National Breastfeeding Month, World Breastfeeding Week, and other things that many of them do a lot of community outreach, once a year or once a quarter activities. And that state coalitions said that the local coalitions often complement their activities and efforts, so it was a good partnership. Though in the bigger states where distances were large, you saw that the coordination was much less. You could have a state like Delaware where the state coalition there are not many local chapters, but you see a state that is larger where, like Pennsylvania, where driving to the other end is longer. So you see that there is a greater need for virtual networks and other ways that coalitions might want to meet, so that in-person meetings are harder. The one thing that was a very, very consistent theme with all of the coalitions were that those that had good support or networks with their state health departments, whether the coalition sat at the table on other matters, obesity prevention, chronic prevention, infant mortality, other initiatives, or where the state health department had a staff who was an active member of the coalition, we found that partnership, when it was strong, made a huge difference to how much impact and scale and spread the coalition had in terms of funding, in terms of their ability to take on, get and take on projects. And again, some of the biggest challenges were that often, although the E-list was big, that there was a small core of volunteers that shouldered most of the coalition responsibilities, the lack of diversity as we've seen, and then also that people felt that there were too many barriers to coalition participation. Most coalitions did have some kind of option for a phone call-in meeting. Very few had any structure for web meetings, so people, almost all coalitions had in-person meetings, and it was hard for coalition members who were there as volunteers to take time from work or get reimbursement for mileage. And about 5 to 6 coalitions we spoke to had were struggling with turf issues and shared agendas and leadership challenges. So they were ones that needed an extra level of coalition building support. Lack of infrastructure funding is definitely the biggest barrier to coalition effectiveness, according to the coalitions themselves. Most are dependent on short-term funding opportunities, so often they feel like if they don't use all the bandwidth they have among the membership to take the long view and commit to multi-year ambitious efforts. Again, this was done in 2013 and 2014, and the tide is a little different now, and a lot of the local and state coalitions are now involved in multi-year projects, such as the Best Fed Beginnings, such as work with other public health partners. So we see more and more coalitions taking on projects that continue for 2 and 3 years, which is really gives them a chance to grow their, to work on a work plan that is feasible and viable. So after we got a general idea of what the coalitions were, some of the strengths and challenges were, what some of them wanted to, we also asked them, what do you most need in terms of training, technical assistance, and capacity building? And funding, fundraising, grant writing support was top. Most coalitions wanted to be independent entities, even those nested within the state health departments, like the support of the state health departments, but did want to at some point in time be the kind of multi-sector independent entities that, and so governance was a big one. Many acknowledged that they did not have engagement and partnerships with the communities like they'd like to see, and wanted to learn more about community engagement. Data was a big one, and our CDC friends will be happy to know we've been getting a lot of requests from coalitions to say they're excited about the data that comes out and that they want to be able to use these in the most effective way possible so that they can use their scarce resources and use their coalition time and talent in the areas that most need breastfeeding support. Communication was a big one. Most of them were experimenting with social media, but wanted to have more of a integrated, consistent communication plan. Many wanted to use emerging technology, video conferencing, other collaboration tools for their peer sharing. And almost all coalitions were very, very cognizant of the fact that they wanted to measure what they were doing, and they wanted to learn how to do effective evaluation and QI processes for their own work. So it was just such an honor to be able to work with coalitions over a space of a year. And one of the things that this process has been long is that as this process was going on, where we were collecting data from the state coalitions, and for many, it took them, many state coalitions were not ready, and it took us over a year to get the response from all the coalitions. USBC at the same time was making a lot of internal work, and we experienced a significant leap in our own growth. And with your help, we created a new strategic framework with equity and collective impact principles as core. So our support plan for the coalition capacity building embeds all the learnings that we ourselves have gone through during this process. So if you look at the what we call the MEC is the markers of effective coalition. So this is a combination of things from the literature review and things that we learned from the coalitions, that the coalitions told us that these are things that if we feel are the elements of a high-functioning, effective coalition. So the 7 different markers are 7 categories are governance and leadership, membership, culture, meeting operations, communication, impact, and funding. These are the 7 categories, and there are indicators under each of these. And this toolkit that we developed actually has the coalition's indicators along a continuum. So the matrix is a tool that lays out the measures of coalition development across 4 stages: a startup, young, developed, and seasoned. And the defining markers again are along a spectrum, and they are embedded with collective impact and equity language as well. And they provide a dashboard on which coalitions can map their own progress in these 7 distinct categories. So as you see on the 3rd bullet is that we are really excited that the conversations with CDC are on to translate these priority indicators into a quantitative format that will be incorporated into the CDC Breastfeeding Report Card. And the inclusion of state coalitions as a process indicator on past report cards has helped to heighten the awareness of the role of coalitions in the public health infrastructure. So we will have a special webinar very soon to discuss just the toolkit and how you can use these markers of effective coalitions. And during that webinar, we'll tell you much more about how these indicators will be mapped and will be shown on the next CDC Breastfeeding Report Card. So this is just a snapshot of some of the of a page of the matrix, and you can see this is governance and leadership. One of the elements is documents and clearly defined roles and purposes, and you'll see that we have 4 categories: startup, young, with descriptions for each. And each of these levels have resources embedded into them. So we have culled and collated the best resources for you, so that if you go under governance and leadership and you feel like you have the documents, you have bylaws, and you have all of that, but you really struggle to have productive board meetings where a lot of action happens and follow-up happens. People come and talk, but there's not much happening after that. So for each of these indicators, we have resources, capacity building opportunities, worksheets, and things that you can engage in to look at where you want to invest your time in capacity building is. So what's beautiful about this matrix is, and I'll just zip through some of these, strategic planning. There's just so much that we are going to be doing together on strategic planning, looking at the internal coalition view, looking at the external, and also how we engage with the prevention strategies of our own state and regions. We have all these different among membership participation, how to recruit more members, increase members from diverse sectors. So each of these have resources, and we'll be doing webinars, other sessions with state coalitions to work on getting more support for you to build your management muscle and rigor. And so this matrix, as you see, will be something where we found that as we were collating the data, that it became clear that coalitions couldn't be clearly placed into just one stage of development. We had coalitions that were pros and absolutely seasoned and developed in advocacy, but did very little in terms of community engagement. We had some that were fabulous at communications, but struggled to have documentation and governance. So what this matrix does is it allows you to assess your own coalition. So it's a self-assessment tool. Instead of USBC trying to pick a best fit for what stage your coalition is in, whether you're a startup, whether you're a seasoned, or whether you're a developing coalition, you use this tool, and on each of these indicators, as collectively, you can plot where you want to be, and it gives you the pathway to get to the next stage, and it gives you prioritize which ones for this year or next year or in the next 6 months you want to, which elements of these do you want to build your capacity in. So it's really a tool that is best that you use in collaboration with your own leadership and membership. We did a lot of work with community engagement, and as you can see, our next coalitions conference will also have a big focus on community engagement. We found that coalitions were mostly very health-centric. The membership were healthcare or public health. And besides the peer support, the LAL-HA League members or WIC support, there were very little representation of faith folks, people from the business, employer community, people from other stakeholders from the community, and most coalitions felt that they really needed to be able to scale their mission, and they needed that this sector was one that they needed to engage with more. So we heard from you, and this will be a big focus for us in terms of training and technical assistance to you in the coming months. Funding and sustainability, again, some coalitions did have diverse sources of funding where they had got some from state, health department or WIC, but they also had foundation funding, but many had one source, and often if that dried up, it had repercussions on coalition functioning again. So a lot of what we've been talking about today in terms of what we found from the needs assessment, what you told us in the phone conversations and through the online surveys, and what you highlighted for us was how do we create a bigger framework. So how do we create a framework to ignite action? How do we build stronger collaborations? How do we value our constituents as thought partners? How do we have a new kind of leadership for coalitions, where coalition leadership can be so different from nonprofit? We need different skill sets for leadership, and these were all things that the coalitions themselves wanted very much to get training and support. Values at work partners, and for state and national level advocacy action, and we will plan to continue doing that every quarter. So these are the two top bullets that you see are the 222 and the existing Partool series, but starting fall of this year, we'll be adding two more webinar series to our roster of support for coalitions. One will be on collective impact, and one will be on racial equity. And all of these two new series will be combined. The webinar will be combined with blogs on topics of collective impact, and then also a networking meeting where after the webinar people can get together and discuss the issues that were done. So these will be pretty intensive capacity building that we hope will be valuable to you. So the Coalition's Learning Connection is again a great place for you to find past webinars, libraries, and a lot of great resources. We have listservs, so you can join a certain learning. Once you join the Learning Connection, it just takes 2 seconds. You have to put your give your email address and a password, and you can join any, start an individual profile and then join any of the learning connections. So these are some ways in which you can use our website in deeper ways. You can come visit the website without having to sign up for anything, but if you do sign up to have an individual profile, then you can be a part of some of the vibrant learning communities that we hope you will participate in. We have group profiles for coalitions, and I was just speaking to a state coalition person who's working on legislation in their state, and they said that, you know, I really wanted to go and see what some of the other state legislators, who else is working on this, what have they done, and our workplace Queen Cheryl was able to get her the information, but we know that the more state coalitions come and fill out their group profiles and let us know what you're doing, the better it is for peers to find you and for you to find peers when you are working on your initiatives. We have these action directories and learning communities, and I also want to let you know that Danae, our coalitions coordinator, is a whiz and just very eager to help you all. So for those who haven't set up their group profiles, we'd be happy to help you do that, and Danae would be willing to help you set up your group profiles as well. Lastly, we are so excited, besides the virtual work that USBC will be providing the state coalitions, we are so excited about our new partners in the breastfeeding public health arena. So for many of our coalitions, as you know, are involved in work with other entities, and we have ASTO, which is the Association of State Territorial Health Officials, has a CDC-funded breastfeeding state learning community, which is working with 17 states. And if you you should go to their website. They have a vibrant learning community. If your state is one of the ASTO grantees and you don't know about it, be sure to contact their state health department and see how your coalition can be involved in this, in the initiative. It is on maternity care practices, workplace, as well as peer support, 3 areas. NACHO, which is the National Association of County City Health Officials, is funded again by CDC, working on reducing disparities in breastfeeding through peer and professional lactation support, working with a range of communities with predominantly African American population. And then CGBI is doing, with APT and other partners, working on the Empower, which is a hospital-based maternity care practices QI initiative again. And we will be learning very soon from CGBI about who the Empower grantees are. But the best thing about working with health partners is that we are working to make sure that our grantees often overlap, that we learn from each other, that we don't duplicate efforts, that we streamline processes, that we work in unison on advocacy. We're so glad to have a funding partner like CDC that is really looking at the grassroots to treetops. You can see through this of how big the spread and depth of some of the breastfeeding work that is happening across the country. And this is just a picture of some of the projects that are CDC funded. You can see the ASTO states, the Best Fed Beginning states that just finished, the Empower that is coming soon, Workplace, CDC funded, peer professional community support. And I stole this slide from Kelly Scanlon, who presented it at the USBC membership. But this slide shows you that every single state and territory in the US now is CDC funded to do breastfeeding promotion and support work. And we should be really proud that we are all in the field at this time where there's such a tipping point for the work we do. So with that, I have spoken a lot today, but I know that we would not have been able to undertake this effort without the involvement of so many of our coalition leaders and members. And I want to thank you all for your support. The willingness of you to be profiled in the report, to share the capacity building experience was absolutely critical. You dedicated time, energy, and thoughtfulness to the effort, and we are so grateful for the opportunity because it's helped us as USBC learn how better we might be able to use the resources and bring the support that we promise to bring to the coalitions. So I hope that with these findings and the toolkit that will be on our website, that you will have greater clarity and understanding of the value of capacity building and the essential role that it allows us to achieve our mission by mobilizing action for policy, systems, and environmental approaches. So with that, I am going to turn it over to Danae and see if we have any questions. Danae, we can't hear you. You might need to unmute yourself.
Can you hear me now? Hello?
Yes, I can hear you.
Okay, perfect. Thank you so much, Kinkini, for such a powerful presentation. We have the feedback coming in already. We just have one question right now, and it says, for the 2016 report card, will there be a more recent survey of the coalitions versus using data from 2014?
So yes, if I can, we will be working on that with CDC, and because this was a really good way to get some baseline information for us as well. And we've been working closely with the group over there. We will be doing some form of data collection for sure, and in the webinar that we have, we'll be able to tell you more about what it is. A lot has changed since the time that we have this data, and we want to make sure that we use updated data for the report card for sure.
Great, great. As of right now, we don't have any other questions. So we can turn it over to
wonderful. So
yes.
Great. So I think Paulette Murphy from CDC is going to give us a quick update. Paulette, you're on.
Yes. Can you hear me?
Yes.
Yes.
Hello. Okay, good, good. Thank you, Kinkini and Denise. I want to give a few announcements from CDC. I'm Paulette Murphy, and I'm the Deputy Branch Chief of the Nutrition Branch. Both Kelly Scanlon and Carol McGowan are at a training today. So it's my pleasure to talk about some of CDC's activities. being launched next week, beginning August 17th. We plan to inform states by posting on the weekly Wednesday Wire in which states the MPINC contractor is starting to screen hospitals. This screening takes a number of months, since MPINC is the census of all hospital facilities, requiring that is all of my updates. Also, I would love to take questions from anyone.
Great. Thank you so much, Paulette. How exciting. I think we are waiting with bated breath for next week, and also for the vital signs in October. That is wonderful.
Yeah, it is all very, very exciting.
We do have, when will hospitals receive the 2013 benchmark reports? Do you, this is from Marcy Brewer from Louisiana.
Well,
this would be the breastfeeding, no, the 2013 benchmark reports for MPINC. That is coming up next week, right?
No, what is coming up next week is we start the very beginning of the process of the 2015 MPINC survey.
Right.
So the 2013 benchmark reports were sent out last year. So if anybody has any questions about their benchmark reports, they can send a question to the MPINC mailbox at mpinc@cdc.gov.
Yeah, and we will post that because a lot of questions are coming in about where, what is the link, where is the CDC website. So Danae will just type that in, cdc.gov, and we'll make sure to share that with our listeners. But we have a lot of listeners today, and thank you so much, Paulette.
Okay, you're welcome. And all the breastfeeding information is at cdc.gov/breastfeeding. And when you start there, you can find everything.
Perfect.
Yeah.
All right. Well, Danae?
Thank you so much, Paulette, for those important updates. We actually do have one more question, Kinkini, if you'd like to take that question. In the findings of the needs assessment, where would the definitions of each parameter be listed?
So all of the definitions are listed in the MEC toolkit. So each of the ones that we spoke about, the governance, there are indicators under each, and they are listed not just as one aspirational, with a perfect score of 100, but a definition for each of the stages of coalition development. So we saw so many that were still in the startup stage. And what can you expect? What is the range in terms of being in the startup? What is it being a seasoned or a developing coalition? So these are all on the toolkit, along with the resources that help you get to the next stage of your development. And this should be the needs assessment and full report, and the matrix, as well as all the resources, will be available on our website. We are still tweaking some of the areas where we want to upload these things, and so they are not yet for public view, but I'll send you an email as soon as you can access it. It should be within this month, and we'll let you know. And we'll, like I said, today was just giving a very broad overview of what the coalition findings are, but when we do release the toolkit, we'll do a very short presentation that we will record, and you can see it at your own time, but that will help walk you through the different sections of that toolkit. So I hope that answers your question. Yes, you will have copies of all the slides, and you will have all of these for download, and the recording is for this as well by tomorrow.
Great. Thank you so much, Kinkini, again. Well, that brings us to the end of today's session. Again, there will be no regional calls today since we used the time for the 222. Thank you for all you do to improve the lives of women, children, and families. As Kinkini mentioned, the recording of this session will be available on our website tomorrow. We hope very much that the 222 webinars bring you ideas for partnerships. Goodbye for now, and I look forward to having you all for our next webinar session. Take care.